Technique of the passage of metal instruments. The penis, properly cleansed, page 27, and with foreskin drawn, is held at right angles to the patient's body, while the lips of the meatus are lubricated by a touch with the tip of the instrument. The shaft of the instrument is held over the fold of the groin, its handle nearly in contact with the skin, from which latter, the integument, first of the groin and then of the abdomen, it is not to be removed until the point of the instrument is about to enter the membranous portion of the urethra. The instrument, at first held along the groin, with point high and handle low, figure 19, is introduced at the meatus, and the penis molded up over it. It is not pushed into the urethra, but the urethra is made to swallow the instrument, as it were. When the curve and perhaps an inch of the shaft have disappeared within the meatus, the handle of the instrument is swept around over the surface of the belly, so as to lie exactly over the linea alba, parallel with it, and still close to the integument. The whole shaft of the instrument is now to be gently pressed toward the patient's feet, being still kept close to and parallel with the surface of the belly. The penis, meanwhile, being lightly grasped behind the corona glandis and held steady. The point of the instrument may be followed with the little finger of the hand which manages the penis, and when it gets fairly past the penoscrotal angle, the whole scrotum, with the testicles and penis, should be largely seized with the hand and pressed against the pubis with slight upward traction. Figure 20. The point may now be felt to settle down and adapt itself to the subpubic curve, after which the weight of the instrument, properly directed, should carry it into the bladder. As soon as the curve lies well against the symphysis, the scrotum, testicles, and penis should be dropped. The hand which held them takes the instrument, steadies it in the median line, and gradually carries the shaft away from the abdomen. Figure 21. Making the handle describe the arc of a circle, and depressing the shaft between the thighs until it lies nearly in the same plane with them. No pushing movement should be imparted to the instrument during this time. The handle is made to describe the arc of a circle, and in a healthy urethra, the point cannot go astray. While the instrument is being depressed between the thighs, the free hand is employed in a pressing down upon the mons veneris and the root of the penis, figure 21, to stretch the suspensory ligament, a point of importance to the easy introduction of an instrument. The instrument should be withdrawn with the same deliberation and care with which it is introduced. No traction is needed. The motions used in introduction are simply reversed. The handle of the instrument is lightly caught and without traction made to describe the arc of a circle until it touches the abdomen over the linea alba. It is then carried around to the groin and, by a tilting motion, unhooked from the urethra, ending exactly where it commenced along the groin, the handle low, the point high. The first principle of instrumentation in the urethra is to avoid the use of force. Even in a healthy subject, the beak of the instrument may become pocketed in the floor of the urethra. It is to avoid this that upward traction on the scrotum and penis is made, whereby the beak of the instrument is held in contact with the roof of the urethra, the surgical wall, until it gently slides of its own weight into the bulb and impinges against the triangular ligament. Here, the beak of the instrument naturally sinks into the sinus of the bulb and ceases to advance. Now it is that the operator, by pressing downward the mons veneris, tilts the instrument so that its beak touches the roof of the canal and slides gently into the membranous urethra, the cutoff muscle relaxing before it. But often the beak is not so readily liberated. That it is still caught in the bulb may be known by the bulging out of its curve in the perineum as the shaft is being depressed between the thighs and by the rebound of the handle when liberated. The obstacle is overcome by gently maneuvering the point of the instrument, by partial withdrawal and reintroduction, or by slight depression of the beak, then lifting it over the obstacle with the finger in the perineum, at the same time pressing down upon the shaft of the instrument to make its point sweep the roof of the canal. The dangerous tour de mater should never be tried, nor any force used in the manipulations at this point, as a false passage is easily made here and under these various circumstances. Footnote: the tour de mater consists in introducing a sound with the shaft between the patient's legs until the point is arrested at the bulb. Then the handle is rapidly made to describe a semicircle until it reaches a vertical position, when it is at once depressed between the thighs. This is brilliant but dangerous. The depression of the handle of the instrument alone is capable of exerting enormous power. The sound represents a lever of the first order, and the surgeon has the long arm. With a little patience, a suitable instrument will always pass into the bladder unless there is a stricture. When the point has traversed the membranous urethra, it must continue on freely if the prostate is normal. The so-called spasm of the neck of the bladder does not exist as an obstruction to the passage of instruments. The sound need only be introduced far enough to bring its greatest diameter into the membranous urethra. This is accomplished when the shaft has been depressed almost, but not quite, to the plane of the body. To pass it farther so as to straighten out the prostatic urethra is unnecessary, painful, and, in certain cases, dangerous. Instruments small enough to engage in the sinuses of Morgagni are not used in the healthy canal. Instrumentation in morbid conditions will be detailed in connection with the different diseases requiring it. The cystoscope and the stone searcher are introduced in the manner above described, but the depression of the handle is carried far enough to permit the angle of the instrument to slip over the bladder neck, an occurrence signalized by a distinct jerk on the part of the instrument. The sensation experienced by a healthy urethra is that of hot points pricking the canal along the part being traversed by the instrument. As this enters the membranous urethra, a desire to urinate begins to be felt, which increases as the prostate and the neck of the bladder become distended by the instrument, so that the patient sometimes believes the urine is flowing away, in spite of the surgeon's assertions and his own observation to the contrary. Nausea and even syncope may occur as the instrument distends the prostate, especially on the first introduction in sensitive young people. Occasionally, distension of the prostatic sinus produces a partial erection. If the patient faints, the instrument should be withdrawn at once and the legs elevated, while the head is hung over the edge of the lounge upon which he lies. The facility with which this may be done, if necessary, is one of the reasons for placing the patient on his back for his first catheterization. The more serious complications of catheterization, such as false passages, urethral fever, etc., will be considered in the succeeding chapters. Ordinarily speaking, none of these complications need be expected to follow the gentle passage of a clean instrument into a urethra which is neither inflamed nor lacerated. But in order to avert the possibility of cystitis or chill, it is safe to terminate every catheterization or sounding by an installation along the whole urethra of a few drops of silver nitrate solution 1 to 1,000, unless some other solution is used as a part of the treatment or the temper of the urethra is well known.